Welcome to the Wellness Law Podcast, where wellness and the law meet for contemplation and collaboration. This podcast is brought to you by the Center for Health and Wellness Law. I am your host, Barbara Zabawa. Welcome, Chase Sterling, to the Wellness Law Podcast. I'm so thrilled that you are here and to talk about your Wellbeing Think Tank. Everyone, I'd love you to meet Chase. She is a leading expert in workplace well-being. She's the executive director for the Wellbeing Think Tank, which started out in 2021. It is a 501c3 tax-exempt organization, and she's going to tell us a little bit more about what it does and why it does it. But Chase has a lot of experience in workplace wellness, and of course, I have an interest in workplace wellness law. That is why she is here. We've met in different conversations or different organization and conferences, and now she's here on the podcast. So welcome, Chase.
Yeah, thank you so much, Barbara. I'm excited to be here, and hopefully I can share some knowledge with your audience.
Based on our conversation before I hit record, I know you have a lot to share and a lot of passion in this space. So tell us first, what is the Wellbeing Think Tank? I think you just had a conference last week. And why did you start it?
We did. I'll be honest, I'm still a little tired from doing our summit. It was our 6th annual conference, but we actually put on events every single month. So it's a lot of work all of the time. But I have been working in workplace wellness for pretty much my entire career, over 20 years. And I've been on every side of the industry. So I've been on what I call the wellness side, which is typically really focused on health promotion and improving the health of a population. And I've been on the carrier side, the broker side, the vendor side, and I really understand that. I also happen to have my educational background is also in industrial organizational psychology with a focus in occupational health. So I've always been intrigued by everything else that impacts our health and well-being. So I like to say when it comes to well-being at work, all you need to do is everything. And the gap I saw in the market was everything is very siloed. So we're not really looking at the big picture of workplace well-being. So workplace wellness tends to be siloed. That tends to be something that's in our Affordable Care Act. It's legislated. It's really around health promotion. But if you want to work on that problem, you also need to work on some of the other systems issues. So part of our logo is actually how do we support the individual and also change the system? So it's about the individual and organizational well-being. It's also about those of us with experience passing on our wisdom to the next generation, but also we're connected. So how do we really collaborate and listen to one another? I don't think any one person has the answers to all of these problems, nor does one organization. We don't claim as an organization to know everything. We really elevate evidence-based practices from other organizations as well. And that's just a snippet. That was a lot already. And I know I talk a lot, so I'll pause for a second. But that's a little bit of why I started Wellbeing Think Tank.
Yeah. So just to kind of summarize, you started it because you feel like a lot of workplace wellness is siloed and you wanted to integrate these different aspects that face an organization and kind of show them how these different facets that are often looked at in a very singular way, that it's all interconnected. And I love that. Well, in order to attack wellness, you have to look at everything. I'm paraphrasing your tagline, but I love that because it is all interconnected. And something that you said to me before I hit record that I just wanted to get your thoughts on because I thought it was very interesting and a little surprising is that outcomes-based programs are starting to come back. Could you talk a little bit more about that? Because I think it's related to healthcare costs.
Absolutely. So organizations have lots of different problems they're trying to solve. They're trying to solve the problem of how much they're spending on healthcare. And there's multiple different ways you can try to work on that issue. They're also trying to work on making sure they have best in class individuals who want to work there for recruiting. They're also trying to retain those individuals. And there's a lot of money that's sunk cost into attrition. So businesses are trying to solve all these different problems. And the problem of healthcare is still a significant problem. We have small businesses spending more money on healthcare than they are on payroll, and it's not sustainable. So organizations are really just trying to figure out what the heck to do to try to mitigate some of that cost. And we're seeing a significant rise in outcomes based programming where individuals have to meet certain biometric standards to then receive a discount on their health plan. So that business problem of healthcare cost is significant. But again, we tend to silo it. And there are lots of different strategies and things we can talk about when we're talking about how do we improve the health of our population. But we have to think larger because everything's impacting our well being at work. It's our leaders, it's the physical environment, it's the policies we have. It's again, it's just about everything, which can feel very daunting and overwhelming. But if we take that step back, we can do better at building these integrated strategies that are really thinking about all of those little pieces. And we should see better results when we really identify what problem are we trying to solve? And then what are we doing? Why are we doing it? And how are we going to measure if it's impactful?
Yeah. I'm curious to hear what has been your experience with employers who are trying to tackle the accelerating healthcare costs problem that all employers are experiencing. And I understand why they might look at outcomes based programs as maybe an easy fix or at least a temporary fix to bring down their costs by basically offloading it onto the employees who don't meet whatever outcomes measures they're designating. What is the appetite of employers to do more of the hard work, the less easy work of taking a step back and looking at the environment, both inside the organization and outside the organization, to really tackle the more the root causes of the problem?
It's a challenging problem. It's a challenging discussion because the majority of employers like to point the finger and they like to say, we know there's a problem. And hey, Barbara, you need to fix yourself. This is a you problem. So we're going to provide you with all these tools and resources. We have invested in amazing things to help you help yourself. But this is actually entirely a you problem. And part of my job and part of Wellbeing Think Tank is helping more people understand how to facilitate these conversations about how do we as an organization look in the mirror and see, are we doing anything that's contributing to maybe some of these individual level issues? So it really is the symbiotic relationship between an organization and an individual. I have a lot of chaseisms. And one thing I say frequently is, of course, as individuals, we have a personal responsibility to care for our own health and well being. But the role of a workplace is to, at a bare minimum, not cause harm. But however we enter the workplace that day, at a bare minimum, we should be leaving at the same. But most of us are leaving lower than when we went in. And so I think we have to shift more responsibility to the organization of what is within our power. And that doesn't mean babysitting people. It doesn't mean you have to fix all their problems. It doesn't mean you're their therapist. But we're a bunch of messy humans. I like to say we're all just a bunch of trauma bags in the workplace. We're all carrying everything into work with us. Being a human isn't easy. But workplaces shouldn't make life any harder. And I think in an ideal society, workplaces could take more responsibility on the outcomes of employees. And I just always think about, imagine a world where we all left work for the day and we felt good.
Yeah.
Imagine the ripple effect that has into not just our own lives, like our small circle, but really our larger communities and society. If people are not feeling dragged down, if they have enough money to pay their bills, they're being paid a living wage, they feel psychologically safe when they're at work, they feel like they belong. And of course, organizations need to make money. They need to be profitable so they can pay us so this whole system works. But I
Mhm.
just really think we can do things better. I think the way we're working now isn't working. I just went so many different directions. But to bring it back to healthcare, organizations are really struggling. So they're really trying to figure out, how the heck do I try to tackle this problem? And we need more people to have these conversations to really say, hey, I know we're really struggling here, but what else could we be doing to really look at the problem holistically? So, an example I'll say is, during some of those peak early COVID years, we saw an increase in individuals using their mental health benefits. So, we saw people accessing services like therapy more. We saw an increase in pharmaceuticals for mental health. And I sat through several claims meetings with self funded clients who said, gosh, we're seeing such an increase in this. What if they weren't medicated? What if they didn't have access to that care? How would that be impacting productivity and turnover and your business operations? So there's a cost. And no, you couldn't control all of these things going on with society at that time. But what can we control within the workplace? So these are really complex problems, and they're very nuanced. And so, yeah, that's another reason why I formed Think Tank, was to get more people talking about this nuance and all these different aspects of workplace wellness, so we can take it back to our organizations and think differently about these problems, and hopefully develop more cross-functional teams, get more stakeholders in the room so we can have these complex conversations and figure out, how do we work together to try to really improve the workplace, which is going to help the organization and the individuals working there.
Yeah. Have you found any type of messaging that resonates with the decision makers inside of employers? I assume that the people coming to your Wellbeing Think Tank conferences, events, aren't necessarily the CEOs of organizations. They may be HR professionals or well-being professionals, others who have an interest in improving the work environment and employee wellness, but ultimately need the stamp of approval from the CFO, the CEO, and all that. What is there a message that the individuals who come to your events take back that works with getting these decision makers on board and looking at more holistic approaches to employee well-being, as opposed to the paternalistic approaches that have been so pervasive in wellness so far?
Yeah, there's a few things we do. So, one thing we do is our programming. So, every quarter we have an overarching theme, and then we do 3 events. So, the first month we look at that problem or theme through the organizational lens. So, what can an organization do? Then we look at it through the individual lens. So, what can we do as individuals? And then our third event is where we come together as a community of practice. That's really the think tank, and we do a lot of sharing. So, this is what I'm doing at my organization. Here's what I'm doing. How do we learn from one another? Then, from a tactical perspective, we do want to try to teach people these skills as well. Some of the things I do whenever I'm training people or teaching them how to have these conversations is, first, what does the C suite really care about? What is the business problem they're trying to solve? So, a lot of individuals who come to our events, they're all in on workplace wellness and well being. They're into this. They know it's important. They want to do everything, but they have to figure out how to sell it. And so, we do some tactical instruction of, what is most important to your C suite right now? And what is the problem they're asking you to solve in your role? And if it's the problem of healthcare costs, you need to shape your narrative around that. But then there's a way you can feed things in. So, when we are able to provide you with evidence based resources or data or interventions you can consider, you can say, hey, at our organization, here's what we're seeing as far as claims, as far as maybe mental health. Here's also our employee engagement data. Here's how people are feeling about their leaders. We know if people are being stressed out, this could be impacting this. It's, how do we help them present that business case to the C suite of, so My recommendation is we actually bring in someone to do X, or we do this program or this intervention, or we're going to do this. But the impact we want to see, how we're going to measure if it's successful, is over here on the health plan part. So it just depends on what business problem we're trying to solve. That is some of the tacticalness. I think it's even if you are like, okay, I know we need to work on training our managers more, which is like the lowest common denominator. Every time we talk about anything, it's always, are our managers empowered to do this work? Are they being supported? We always have to talk about that. But we're still, they want to see this impact in this very like nuanced thing over
Tangible.
here, or we want need to close gaps in care. It's great. So we're going to do this in a variety of different ways. So I'll use gaps in care as an example. So something from a healthcare perspective, employers tend to want to do is increase preventive care compliance. So we have to not just say, okay, we're going to incentivize everyone. We're going to offer everyone a discount or a gift card or something, because that's going to get them wanting to do their preventive care. Not really. What are the reasons why they're not getting their preventive care in the first place? It could be policies. I've had great success working with hourly based and shift work where they get 8 floating hours a year that they get to take in 2-hour chunks. So the supervisor works with their workforce. And throughout the year, Barbara, you can either come in 2 hours late or leave 2 hours early. We always recommend to leave 2 hours early because of the way healthcare appointments go sometimes. But we're going to let you leave work, paid hours. Those are paid hours on the clock. So that could be a barrier. Maybe you can't afford to take time off. But if we give you paid time off to go get your preventive care done, and then you're working with scheduling and your manager's being held accountable also. So your manager, part of your maybe KPIs, OKRs, or hey, we are going to hold you responsible for getting this percentage of your workforce to take time off to get these appointments. And then what else is going on? Is it cultural? Do we need to help them find access to primary care in a language other than English? Is it a cultural thing where maybe they don't believe in certain things, but we still want to get them to their cancer screening, some of these things. So it's how do we have conversations? There's just so many different pieces that we can work on it. Then it can be communications. Are we doing direct employee communication? Do we actually need to communicate to the home? Because perhaps the culture of the organization, it's more of the people at home who are managing things like healthcare for the family. So again, these problems, there's no one, hey, just do this. It's, we know best practices, but what it looks like in practice is so different. Every organization I've ever had the privilege to work with, I will tell you, no strategy has looked exactly the same. So I draw from all these best practices, but how it's implemented looks extremely different when I'm working with plumbers, as I'm working with maybe a hospital system, as I'm working with white collar office workers or retail and restaurant. It's all very different. But yeah.
Who's doing this implementation of these ideas of the best practices that you're describing that are so organization dependent? Obviously, you can't possibly be doing all of these for a long period of time. You could do some training but somebody has to take the ball from you and continue the work. And who are these individuals that do that kind of work?
We definitely need more people who can do this kind of strategic level work. And that's part of Wellbeing Think Tank, is providing more access to training and education to prepare people. Of course, in many organizations, this falls on HR, because if HR doesn't have enough to do, congratulations, you get this as well. If you're lucky, you might be at an organization who has someone in charge of wellness. Sometimes it falls on just passionate workforces like ERGs or committees. Ideally, though, it would be great to have someone at every organization who is in charge of this strategic work. It could be a project manager type role. It could be a program manager. It could be a leader. I don't think we need to get into the semantics of all of that. We do want representation at the C-suite level, someone who can speak to why these are business problems that you should care about. Because if you're talking to the C-suite or a board, we are responsible for the health of an organization, and signs of health are not just profitability. And I think this is where we get hung up a lot. And I see this happen a lot at conferences or wellness events. Something we say at Wellbeing Think Tank is experts over influencers. And even brands can be influencers. So people might really know a company name. And so they're like, oh, that must be a great place to work, or they're doing great things because they're profitable. But there's other metrics. Turnover is a big one. If your organization is making billions of dollars, but your turnover rate is 25%, I don't know. I don't think that's the sign of a healthy organization. And that's not who I want to learn from either. I want to learn from someone who's got a much lower attrition rate, but maybe their profit margins are a little tighter. So yeah, I don't know if that's another reason why I started Think Tank is I have developed my skills by job hopping and moving around. I've moved to a lot of different places in the US. So I've seen many different sides of this industry, but most people don't do that. Most people don't make the career changes I've had. But if I can help other people see that importance and then learn just enough to be dangerous, just enough to bring it into their work, but then know your scope of practice, bring in other professionals. It's really about, I think, developing cross-functional teams, but understanding, yeah, someone has to lead the charge
Yeah.
and do that consultative level work. And hopefully we'll be helping prepare more people to do this work and have these conversations through our work.
Yeah. No, it's excellent work, much needed work that you guys are doing. I'm so thrilled that you were able to come on the podcast and share with me and my listeners everything Wellbeing Think Tank is doing and what you're doing. Just really impressive. And I wish you the best and continued good luck in getting your message across. So thank you so much for being on the podcast, Chase.
Yeah, thank you so much, Barbara. I appreciate spending this time with you. And of course, I could talk about well-being for hours. I
Uh,
appreciate any chance I get to talk about it.
And how can people learn more about your work if they're interested in what you do?
Absolutely. Check us out at wellbeingthinktank.org. Accessibility is really important to us. So we actually have community memberships, which are free. So it's free to be a part of our community. You can access a significant amount of our education at no cost. And then we do have a professional and a practitioner level membership, which gives you a little bit more resources, more guides, more toolkits, events on demand. And of course, we have an annual conference, but I don't want to just do things once a year. That's another reason why I started Think Tank is we offer continuous learning throughout the year. And I think coming together as a community continuously is how we learn through collaboration. So wellbeingthinktank.org, you can email us at hello@wellbeingthinktank.org. And that's where we're at on all the socials. So come find us and hang out with us. And you can even volunteer with us. We are a volunteer ran organization. It's a lot of volunteers doing this work.
Awesome. And yeah, again, just so grateful for you and on the work that you do. So thank you again, Chase.
Thank you.
Thank you for listening to the Wellness Law Podcast. You can find more wellness law resources by visiting the Center for Health and Wellness Law website at www.wellnesslaw.com, where you can also subscribe to our newsletter and follow us on social media. Until the next episode, stay well, stay hopeful, and stay legal.